you are trying to assume it's piles. And piles is बहुत सारे लोगों को होता है, but ऐसा है कि there are certain things that you should not assume. For example, if you are 40 and above as a male person and you have a bleeding all of a sudden which you never bled, it should be assumed as a colon cancer. Rajiv ने ऐसा बात कहा था कि you always assume it is guilty till proven innocent for post-menopause was bleeding, for bleeding in the stools for men after a certain age, 40 years of age, you should assume you have colon cancer unless you prove it otherwise. Which means what? Which means you should come and consult the gastroenterologist and see whether you have this disease. So you may require a colonoscopy. Do not be afraid of it. Nowadays it is easy to do. It's comfortable. हमारे क्लिनिक में हर रोज कोई बोल गया था हमें इतना डर था पर मुझे मालूम नहीं था कितना इजी है. And trust me, it is easy. It has become easy. It wasn't easy earlier. It has become easy because अब सब लोग sedation पे करते हैं, propofol sedation पे करते हैं, किसी को कुछ मालूम नहीं होता. If you do not do this, what happens is the price is too high. If you come to know of a cancer a year later, and if you believe for somebody who is bleeding for a year, then it's a disaster. It's a disaster. So I think very important for all of you, anybody, you're bleeding in your stools, it's all right, it is fresh, it is wet, it is painless, okay, it's possibly piles. If you've been bleeding for years, it's possibly piles. But all of a sudden, if you're bleeding, it's black stool, it's black blood, it is mixed with your stool, it is painful, and it's all of a sudden you never had it before, do check yourself to the gastroenterologist, right?
That's correct, sir. So, sir, एक नया शब्द हमें सुनने में आया है, ब्रेन गट एक्सेस. तो सर आप इस पर रोशनी डालिए, इसका क्या मतलब है, इससे क्या डिजीज हो सकते हैं और इसका क्या ट्रीटमेंट होता है?
Okay, that's my favorite subject. So, brain and gut axis का मतलब ये हो गया कि आपके पेट में जो भी होता है, उसका काफी प्रभाव influences from the brain. Now, what are the things that we talk about? I can talk about dysbiosis, right? जिसका मतलब good bacteria, bad bacteria. That can be altered by your brain. The way you think. As you think, so shall you be. 2000 साल पहले का बाइबल. So अभी भी हम लोगों के लिए वो ट्रू है. आप जैसा सोचते हो ना उसमें आप चेंज हो जाता है इन योर लाइफ. So एक हो गया आपका डिसबायोसिस. दूसरा हमारे क्लिनिक में जितने लोग आते हैं, half of them I would say have irritable bowel syndrome. आप इसमें irritable bowel syndrome, very common diagnosis. What is it? Irritable bowel syndrome. मतलब मेरा पेट जो पहले का रास्ता जो है, it's not going in a synchronous manner. जैसे कि मन कर रहा है, क्यों कर रहा है? Because your mind or brain gut axis is wrong. It's faulty. It is not synchronous, slow, coordinated movements. And this is happening largely because of anxiety. In our world right now, 70% of the world's population has anxiety. If you have a hard-won reflux is ubiquitous support that 70% of us suffer with anxiety. If you move it, 7 out of 10 people have anxiety. What does it mean? It means whatever you hear or you see will bring about a response in you, right? But it will bring about a negative response in you in 7 out of 10 people. Yeah? You see a cloud and you say, oh shit, it's going to rain, I'm not going to go to work. That's a negative emotion. Or you see, you see your child going out and dying, oh my god, what happens if something happens to him or her? You will start having anxiety. You're either concerned about the past or you're concerned about the future. But nobody is in the present. So anxiety is exactly that. And now if you all self-assess yourself, you would probably know if you're anxious or not. Are you the present? Are you listening to Dr. Samaraj?
Yes. Yes.
You're not anxious. So right now if you're in this room, you will not have anxiety. But if your mind is going backwards and forwards, you will have anxiety. And that is the commonest reason behind the faulty mind brain gut axis. And we must all learn to control this. It is very sad for me to tell half of my patients, don't do that, she will tackle your mind, you will have to do mind. And then most of them don't matter. They don't think that they have anxiety. People do stay in denial, and I don't blame them. So there is a huge thing called the gut brain axis. And
whatever disease you can think of, even obesity. There is a large etiology of the brain-gut axis which is responsible for obesity. So today we must recognize this term and we must all work towards our mental health. I'm not saying that we are all mad people. What I'm saying is we just need to train our mind. We train our body to make it look better. We should also train our mind on a daily basis. You may think, I cannot do it. I totally respect that. But I would also say, please draw your attention to the fact that 7 out of 10 people have anxiety in school. Many of us are depressed and won't know it. So if you train your mind through meditation, through morning walks, we go for morning walks, you're probably less anxious than other people. Okay? So I think it's important just to realize that you work on your mind, your gut health will be better. So we started with the gut health and we think that it is not going to be the mind. First, it is a lot of the mind.
It's not about minds. Absolutely true, sir.